Welcome, everyone. Laura Wayman, the Dementia Whisperer here. I want to share some information about the news I'm sure you've all heard about, this new drug for Alzheimer's. So I immediately set about researching everything I could find out about this. So here goes what I found out so far. And I will tell you, I'm saddened that it's not more positive information. So the Food and Drug Administration has approved aducanumab, produced by Biogen under the name Aduhelm. This is the first new treatment for Alzheimer's disease in 18 years. This approval is a victory for people living with Alzheimer's and their families, said Harry Johns, president and CEO of the Alzheimer's Association, in a statement. But the medication is already surrounded by controversy. The FDA's independent advisory committee overwhelmingly voted in November against recommending that Aduhelm be approved, citing a lack of data to prove that the drug actually slowed cognitive decline. Several members of the FDA Advisory Committee also wrote a viewpoint published in the Journal of the American Medical Association detailing exactly why they voted against approval of this drug. Scientists at the nonprofit Institute for Clinical and Economic Review also issued a report in May that said there isn't enough information to show that Aduhelm's benefits outweigh the potential risks. Other organizations, including the American Geriatric Society, also view the approval as premature, given the lack of sufficient evidence to support that Aduhelm reduces the progression of Alzheimer's disease. The FDA's approval of Aduhelm is also a bit unusual. The agency granted an accelerated approval pathway, which is allowing patients who are suffering from a serious disease earlier access to drugs when there is an expectation of a benefit, despite there being some uncertainty about the actual success of the drug. The FDA does say that Biogen must verify that there is clinical benefit in a post-approval trial, otherwise approval of the drug may be withdrawn. So there's more study being done. With every first drug of any kind, it gets scrutinized more by doctors and scientists than similar drugs that might follow. But there are a few reasons why scientists and doctors may be wary of this medication. Aduhelm, like most medications, has potential risks and side effects. Biogen says online that Aduhelm can cause serious side effects, including temporary swelling and bleeding in the brain. Most people don't have symptoms, Biogen claims, but some may have a headache, confusion, dizziness, vision changes, and even nausea. That's why the company recommends that patients undergo MRI scans before and throughout the treatment. It's really unclear with these studies if Aduhelm is actually effective. Again, Biogen actually stopped 2 phase 3 clinical trials of this medication after analysis showed that it was unlikely to be helpful for patients. Even after more data became available, only 1 trial showed that Aduhelm performed better than a placebo. Ultimately, there's just simply conflicting data from clinical trials as to whether or not it works. And unfortunately, it's very expensive, putting it out of the reach of most people. Biogen announced this week in a press release to investors that the cost of the medication will be upwards of $56,000 a year. However, the company said the out-of-pocket costs for patients with insurance will vary, of course, depending on their coverage. Oh, and don't forget, the regular MRIs during the treatment would also be an additional cost. Whether the risks outweigh the potential benefits still is not clear, but some doctors say they'll at least talk to their patients about Aduhelm. There's no question that Aduhelm clears amyloid. The only question is if it reliably reduces the progression of cognitive decline, and if it does so to a significant degree. Because it is clearly effective in reducing amyloid in the brain, doctors may recommend it to people with mild dementia symptoms due to Alzheimer's disease or early on in the disease process only, as this does not reverse any brain function loss that has already taken place. It is clear that doctors need more guidance on which patients are best suited for the drug and which may be at higher risk of these side effects. No drug has yet been shown to reverse the symptoms of Alzheimer's, which affects more than 6 million Americans and has no cure. And this one is unfortunately no home run. Everyone who took the drug continued to get worse. Granted, the study showed that some of those who got the highest doses seemed to get worse more slowly. Yes, of course, we're all still anxiously awaiting science to bring about a better pharmaceutical option. The sooner the better. However, please know this new drug is not a cure and not the miracle pill we are all still waiting and hoping will be just around the corner. I do suggest that you have a conversation with your doctor, but with clear dementia awareness of the limitations and challenges this new option has. And let's all keep our fingers crossed for bigger and better scientific breakthroughs. And check out my dementia-aware tips and strategies in my book, A Loving Approach to Dementia Care, 3rd edition, published by Johns Hopkins University Press. Or visit my website, laurawayman.com. Signing off for now. With love, the Dementia Whisperer.